everyone. Today I'm going to be chatting to you about a really common women's health condition, pelvic organ prolapses. We're going to be having a chat about what a pelvic organ prolapse is, as well as how to manage it. Now, a little bit about me. My name is Kelly, and I'm a women's health physiotherapist at iMove in Penang. Now, I work with two other wonderful women's health physiotherapists, Mads, who works at iMove in Clovelly, and Laura, who works at iMove in Roselle. And we absolutely love being able to support women in their journeys. We often get asked, what exactly do we do as women's health physiotherapists? And well, we help women with conditions that commonly affect women. This might be prolapse, different types of incontinence, pelvic pain, pregnancy conditions, postnatal conditions, and also rehab. So when exactly should you see us? If you're experiencing any of the conditions that I've just mentioned, at any stage during your pregnancy journey or your postpartum journey, and if you're looking or seeking for more information and help around your pelvic floor, we'd love to be able to help you with your journey. So before I get stuck into talking about prolapse and what it means, I just want to cover some anatomy. So what is the pelvic floor and where exactly are our pelvic organs? Our pelvic floor is quite a complex structure, and it's made both of muscle and connective tissue or fascia. It forms a sling and runs between our pubic bone at the front and our tailbone at the back, and it actually has two layers, a deep layer and a superficial layer. Our pelvic floor helps us in so many different ways. It's one of the biggest things is it helps us with supporting our pelvic organs, and it also helps us to stop us from leaking, all right, and a lot of different other things. Our pelvic organs sit within our pelvis and include our bladder at the front, our uterus in the middle that attaches to our vagina just there, and our rectum at the back, or our bowel. So what exactly is a pelvic organ prolapse? A pelvic organ prolapse is the dropping of one of our pelvic organs or more due to reduced support. And there are three really common types of prolapse that we find in women. So the first one is a uterine prolapse, which is where your uterus drops down into the vagina. We've got an anterior vaginal wall prolapse, which is where your bladder drops against that front wall of the vagina. And then we've got a posterior vaginal wall prolapse, which is essentially where your rectum falls or drops forward against the back wall of your vagina there. Now, if you do have a prolapse, you may experience some symptoms. And if you do, some common symptoms are experiencing a vaginal bulge sensation, experiencing the sensation of some pelvic pressure. You may experience some low back ache. You may experience a discharge or more discharge or a different discharge to what you usually experience. You may experience bleeding that is not associated with your menstrual cycle. You may have infections or recurrent infections, and you may feel the need to use your hand to help you pass your bowel motions. You may also feel that you are unable or can't as easily pass urine or your bowel motions as well. So what can we actually do to help you and support you with your prolapse? As women's health physiotherapists, we can help you in a variety of different ways, and it really depends on the type of prolapse that you have, the type of support that you have for your pelvic organ, and then you and your body and what you do in your everyday life. The two main things that we can do is to help you increase the support to your pelvic organ and also reduce the strain on your pelvic organs and the pelvic floor itself. So in terms of reducing strain through your pelvic floor and the pelvic organs, if you're someone who lifts a lot of things, you might be a mum who has to lift her kids, you might be someone who has to lift as part of your job, or you might be someone who goes to the gym quite regularly. We'll have a look at the way that you lift. We might make some changes. And we might also look at how many times you lift throughout the day or how heavy you need to lift as well. We might have a look at the type of exercise that you do and have a look at the form of your exercise and what you're doing with your exercise. As you can imagine, if you have increased in weight, we may have a look at weight management, and we'll also have a look at managing any medical conditions that you may be experiencing, which include respiratory conditions such as asthma or chronic coughing, which sort of put a lot of pressure onto your pelvic floor, okay, and other conditions that may play a role. We can also increase the support to the pelvic organ itself. Now, this can be done in a variety of different ways. One of the most common ways is to be fitted with a pessary, which is a small device made out of silicone usually, that we fit into your vagina to help hold up your organ, pelvic organ, okay? And it really depends on the type of pelvic organ that is prolapsing and some other different factors as well as to what type of pessary we fit you. And we can also have a look at doing some pelvic muscle training, which depends on whether you actually need the pelvic muscle training as to whether we do it or not, okay? But it's a nice way to help support your pelvic organ from below. Now, the biggest question that I often get from women who do experience pelvic organ prolapse is, should I even be exercising? Is it safe? Well, absolutely it is safe. However, you need to have a chat to your women's health physiotherapist to understand a bit more about the type and grade of your prolapse, the structures in helping to support your prolapse, and also the type of exercise that you do or would like to do as to what is safe and good for you to be doing. And that's where a women's health physiotherapist can guide you in the treatment that you need, the management that you need, and how to exercise safely. So come and have a chat to one of us if you suspect or you know that you are experiencing pelvic organ prolapse, so that we can help you with your exercising, okay? Because exercising is really, really important. It has so many beneficial effects on our bodies in the long term. Now, if you'd like to get in touch with us to ask us questions about pelvic organ prolapse or any other women's health condition, here are our details. You can contact Laura, Mads, or I through our emails or through the website or our Instagram account. We'd love to hear from you with any questions that you might have, okay, about women's health. Here's just some citations for the pictures that I had